Heidi, I just wanted to check in with you and see how your first couple of weeks went.
Everything's going pretty well. I've been picking up things pretty quickly, I'd say.
Good.
The rest of the staff really seems to know their stuff.
Well, that's true. Many of them have a lot of experience. In fact, our charge nurse, Cheryl, has been working here about 20 years, so you'll be able to learn a lot from her.
I'm sure I will. I especially liked our staff refresher training last week on quality improvement. It was a great review of what I learned in school.
Yeah, you were very helpful during the discussion portion. I wish some of the other nurses would have chimed in more, but a few of the tools like SBAR are relatively new to this unit. Change doesn't happen overnight.
Yeah, I guess not.
Don't get me wrong, they're all excellent nurses. It just takes everyone some time to adjust to new procedures. Okay, well, I'll check back in with you later this week and let me know if something else comes up in the meantime.
Okay, thanks.
Hey, Cheryl.
Hey, Julie.
Hi, Cheryl.
Hi. Sorry, what's your name again?
Oh, that's okay. It's Heidi.
Heidi, that's right. So, how are things going for you?
Oh, they're good. You know, I really liked our training last week.
Training?
Yeah, you know, on quality improvement.
Ugh, that stuff. You know, all these new tools they're bringing in are just a waste of time, really. I mean, they just make things more complicated.
Oh, really? Well, in school they talked about how quality improvement programs really improve patient care.
Oh, yeah? Well, this isn't nursing school, honey. That's all I can tell you.
Cheryl, just want to give you an update on Mr. Willis. What time is your shift end?
Oh, in about 5 minutes.
Okay, well, please let the charge nurse on the next shift know that Mr. Willis's bleeding times are abnormal. He has a history of 2 MIs and now has AFib. I started him on Coumadin, but his last dose has been held because his bleeding times were elevated. I want to repeat his INR and make sure they remain between 2 and 3 before we start him back on 2 milligrams of Coumadin tonight, okay?
Okay, sounds good. I'll let him know.
Okay, great, thanks. Thank you.
How old are you, anyway?
Excuse me?
Never mind. You'll learn soon enough. Ugh, I gotta go get my stuff. I can't wait to get out of here.
Hey Heidi, how's it going?
Oh, things are going all right. You're just starting your shift?
Yep, got to sleep in a little day, take the kids to the park. Beats the overnight shift anytime.
Well, that's good.
Hey, Mark, how was Chloe's recital?
Oh, it was good. She'll be a professional by the age of 7, I'm sure.
Oh, that's nice. Well, the report is taped. Enjoy.
Gee, thanks.
Oh, yeah, Dr. Swigert just checked in with me about Mr. Willis. He ordered 2 milligrams of Coumadin for him for tonight.
Okay, great, thanks. I'll make sure he gets it. Enjoy your evening.
Yeah, you too.
Thanks.
Mark?
Mm-hmm.
Did Cheryl mention the need to check his INR level?
INR level?
Yeah, the recheck on his INR.
Who's INR?
Mr. Willis?
No, I don't think so. Why?
Oh, well, I was just there when Dr. Swigert gave the update on him. The doctor wanted to make sure his INR was between 2 and 3 before he received his immunin Coumadin.
Oh, really? Yeah, well, that does make quite a difference, doesn't it?
Yeah, I'd say so.
I'll make sure to write it down. Thanks for letting me know.
No problem. Mark, I was just thinking about what Julie taught on communicating last week.
Okay.
Well, shouldn't Cheryl have told you about the need to check the INR results before giving the Coumadin?
Well, yeah, she probably should have, but it was good you overheard. Good catch, rookie.
Oh, Mark, what if I wasn't here to let you know? I mean, this could have been a big problem. Mr. Willis could have started bleeding.
It could have been, but it's okay now. I got it. Okay?
Well, I really think we should let somebody know about this, though, don't you?
You want to tattle on Cheryl? Do you realize Cheryl's been here almost as long as you've been alive? Look, she made a mistake, no big deal, okay?
Well, if we don't use this as an opportunity for improvement, we could miss the correction on the next patient.
Enough quality improvement, okay? Telling on a charge nurse only makes you look bad. Believe me, Cheryl's tight with the supervisors. No harm, no foul, okay?
Hey, Heidi. The lab just called saying Mr. Willis's blood test results are in. Do you know where Cheryl is?
She left. Her shift was over. Mark's here, though.
Do you know where Mark went?
He went that way.
Thank you, great.
Wait, Julie?
Yes, what is it?
I need to talk to you.
Okay, come here. What's up?
Mr. Willis is on Coumadin. His last dose needed to be held because his INR was elevated. Dr. Swigert wanted to make sure that his INR was therapeutic before giving him his Coumadin.
Okay.
Well, when Mark took over, Cheryl only told him that Mr. Willis needed Coumadin and didn't mention checking the INR first.
Did you tell Mark about this?
I did. He said he would take care of it.
All right, good. Oh, thank you for telling me. This really could have been a problem.
Yeah, I know. Our training last week on quality improvement really made me realize that things like this could lead to major problems for our patients.
Yes, I agree. I want to bring this up in our QI meeting tomorrow. I would like you to be there. Can you be in the conference room at 2?
Of course, I'll be there.
Great, thank you. Luckily, Heidi, who some of you know already, was able to catch a near miss and prevent a mishap. Heidi, would you mind sharing what happened with the group?
Yeah, sure. Well, yesterday during change of shifts, I overheard one of the doctors letting a nurse know that one of the patients had to have his dose of Coumadin held because his INR was elevated. But when the nurse handed over the patient files to the next shift nurse, the first shift nurse didn't mention checking his INR first, but only mentioned that he needed a dose of Coumadin.
I feel we all can take this near miss as an opportunity to realize how important proper communication is. In situations like these, ASPAR will be very helpful. Now, Joyce, I know you weren't here for training last week. Does anyone want to give Joyce an overview of how ASPAR works?
Sure, I will.
Thanks, Cheryl.
Joyce, SBAR is an acronym that stands for Situation, Background, Assessment, and Recommendation. For instance, yesterday at change of shift, I should have briefly explained the patient's situation to Mark better than I did when he started his shift. I should have given him more background information regarding the patient's Coumadin dosage and remembered to tell him to make sure the patient's levels were okay before giving him his next dose. Unfortunately, I was in a rush, and she let Mark know what I didn't.
Thank you, Cheryl. This is a relatively new process that everyone will have to get used to. It's a very helpful tool, though, especially during change of shift. How about we start implementing this tomorrow, and we will discuss the differences at our next meeting. Okay, thank you.